We start in Libya now, where the country's internationally recognized parliament is due to hold a vote of confidence on a unity government. The plan is backed by the United Nations. Rival parliaments in the eastern town of Tobruk and in the capital Tripoli last week proposed the formation of a new government of 18 members. The debates surrounding that proposal wrapped up on Monday, and the vote comes just hours after fierce clashes in the eastern city of Benghazi, highlighting the need to end the political chaos. Dozens of militants and more than 20 soldiers were reportedly killed in a series of army operations against militants. Meanwhile, Libya faces severe shortages of life-saving medicine, and about 1 million people will soon be in dire need of help as warring factions hamper efforts to end chaos and form a unity government.
The United Nations humanitarian coordinator for Libya says the North African country could run out of life-saving medicines within weeks, potentially affecting hundreds of thousands of people.
Our estimations is that by the end of March, Libya may run out of life-saving medications, which will impact about 1 million people affected. And by that we mean medications for cancers and other types of illnesses like dialysis, etc. If there's no medication and medicine supplies coming in, that will be a real issue for Libya.
Compounding the many problems are about 435,000 internally displaced people living in schools and other public places, and some 250,000 migrants and refugees who had hoped to pass through Libya and find a better life abroad.
It is a crisis. We see it every day. I mean, if you've reached a point when Libyans who have never felt the need for food are now asking for certain types of food, when we are distributing food packages that include the basics which you could find Libyan originated but elsewhere in the neighborhood in the region.
Since 2014, Libya has had two competing governments, one based in Tripoli and the other in the east, both of which are backed by loose alliances of armed brigades and former rebels. Instability has taken a heavy toll on healthcare facilities. In Benghazi, for instance, only 1 or 2 out of about a dozen hospitals are functioning. A few days ago, Al-Zatari was notified the psychiatric care hospital in Benghazi had no resources. Scores of patients lack proper care. Catherine Ogunde, CCTV.